David Schiller here, and today we're going to be talking about the fifth major pattern of low thyroid, and that is what is called thyroid binding globulin elevation, too much TBG. Now, if you're not getting your TBG checked, then you should be, because this is one major pattern where you can have too much. It's very common because one of the major causes of it is due to oral contraceptive use, so women that have been on birth control pills, or women that are older that are on some type of hormone replacement. TBG levels can also be indirectly checked, not as accurately obviously, but they can be indirectly checked by what is called T3 uptake. So again, if you're not getting checked for all your markers, you're really missing out on a lot of different patterns that could be causing your low thyroid symptoms. So as a result, you're not getting to the root cause and you're still having thyroid symptoms even though you're getting treated. So let's just talk about this, what is called elevated thyroid binding globulin. So again, some basic thyroid physiology. We have the pituitary gland, which talks to the thyroid gland that sits in the base of your neck. The pituitary is sitting up in your brain. What talks to the thyroid from the pituitary is what's called thyroid stimulating hormone. The thyroid then produces T4 and T3, most of which is what is called T4, about 93%. It's inactive. 7% is T3. It's active. So to get the full effect of thyroid hormone, T4 needs to be converted to T3. Both of these are carted around your bloodstream on what are called thyroid binding globulins. You can look at the thyroid binding globulin as a taxi cab. So the T4 and T3 hitch a ride on a TBG to be carted around the body to produce the effects. TBG can become elevated, like I said, because of elevations in estrogen due to oral contraceptive use, birth control, or due to hormone replacement therapy later in life like Premarin or other types of things. So as a result of too much TBG, too much hormone is being locked onto this binding globulin, and not enough of the free hormones, free T3 and free T4, they're not becoming available because they're all locked in onto this protein. So look at all the different markers you can check in a typical blood work to determine where everything is. So free T4, free T3, total T4, total T3, TBG, TSH, and T3 uptake, which I said is one other way of looking at if you have too much or too little TBG. So the idea is you can have this situation where there's too much binding globulins due to too much estrogens due to usage of oral contraceptives. So this is one of the patterns that needs to be looked into that could be causing your low thyroid. So I want to thank you for watching, and I'll see you on my next post, and make it a great day.